Hi guys, how are you? It's really been long, but I want to believe that you're safe and you're taking the necessary precautionary measures. I'm doing well and I really thank God. I know one thing that for sure we are going to get through this. And at this time, one thing that is really important is what is the state of your psychological health? What is the state of your mental health? And today I want us to talk about anxiety because as a person, there's a form of anxiety which is normal, but then there's another form of anxiety that becomes abnormal and actually impairs your ability to do things normally like you used to do. And anxiety becomes a disorder when it's in excessive uncontrollable. You have an exaggerated, excessive, uncontrollable fear for things that you should actually even not fear in the first place. And we have many types of anxiety disorders. We have the generalized anxiety disorders. We have OCD. I know you've had people saying, "Oh, I have OCD, I have OCD." We have panic disorders. And but today I want to focus on one of it, and that is generalized anxiety disorder. So, guys, what is generalized anxiety disorder? We say generalized because it means you have anxiety basically towards almost everything, the bigger things and even the trivial things. And this is whereby you have excessive worry and fear that goes on for at least 6 months. One, two, three, four, five, six. And this is a person who 1 minute will be afraid that something is probably going to happen to the child. In the next minute, he or she will be afraid that, oh, I think something bad is going to happen to my spouse. He or she might get an accident, I'm afraid. Or in the next minute, you're like, oh my goodness, what if I lose my child? And your life is just a life of worry, and at no point are you just seated, happy, comfortable, and just living your life and enjoying your thoughts. And the second thing is that this fear becomes uncontrollable. You try to control it, but you cannot. This someone who's really worried. You try to tell them, it's gonna be okay, but that just doesn't seem to do the trick for these people because it's just uncontrollable. And the other thing is that it impairs with your daily living. If you are a student and you're at school, then it just becomes hard to concentrate in class and you cannot just deliver. For one reason, people don't understand what's happening to the score of this girl or of this boy, but they don't know that deep down you're really struggling with anxiety. And if you are at work, something happens and your work output is just not okay. If you're a cashier at a bank, you don't realize it, but you find yourself always paying shortages. Oh my goodness, I have a short today. And so guys, you know that an anxiety disorder is not a small thing, it's a big thing, and it has to be addressed. And the other thing is that at that time when you're really afraid or you're worried and you have a lot of fear, your body has to respond. And how your body responds is by producing a hormone, and this hormone will bring in place some physiological factors. And these people with anxiety now tend to also have additional physical symptoms. So some of the physical symptoms that you may realize you're having when you have an anxiety disorder is that at that time when you're really afraid is you realize that your heart beats really fast and you become aware of how your heart is beating. You become sweaty. You don't understand, I'm really sweating. You're sweating. And then another thing is that you may start having some stomach discomfort. You did not eat something bad, but you're just having a stomach discomfort because those are some of the physical symptoms that come in play when you're having an anxiety disorder. And so guys, what causes anxiety disorder? You must be asking yourself, all right, you talked to us about the symptoms and what causes it. The truth of the matter is that the real cause of an anxiety disorder is not known. Some things that have been speculated to cause an anxiety disorder, some researchers have said that there's a probability that anxiety could be running in families, and other researchers have said that probably exposure to a life crisis at one point could later manifest as an anxiety disorder. But guys, the most important thing to know is that your symptoms can be known and you're willing to ask for help and management can be done. And so there are guys who will really stay along with anxiety before learning how to manage it. There are those who will take a few time. There are those who might take even 2 years, 3 years, and there are those whom just the condition just becomes part and parcel of them. But what I think is that an anxiety disorder should not be part and parcel of your life. And today I want to share with us a few relaxation techniques that I have seen from the research that I have done. And one of it is the breath focus. Breath focus, this is whereby you try to learn how to relax by taking a deep, shallow breath. So you take a deep breath and then you hold and you release it. So it's not really deep, but like a long, shallow breath. And that really helps. And another thing is that exercise. Guys, you might not realize, but exercising really helps a lot. A lot. Actually, it helps a lot. What happens is that when you exercise, your body is active and your heart is really beating fast, and at that same time you're really sweating. And so there's a way in which now your body will start associating the excessive heartbeat and the sweating, not as an anxiety thing of fear and worry, but with a normal thing. So exercise really helps you a lot, and it really helps you to relax. There are other relaxation techniques, mindful meditation, that really helps a lot. And if you're a person who loves music, there's some kinds of music that actually really help you to relax. As you listen to that music, you do not focus your mind on things that are gonna affect you, but you just internalize the music and you let the wave carry you. And guys, you can also research on other relaxation techniques. That there is what we refer to as body scan, and then there's another relaxation technique which I've seen, guided imagery technique. You can check on that, and I hope it will help you. One thing you must know is that we can manage this. You can manage this. Besides relaxation techniques, which you can do, we have psychological treatments. We have something we refer to as cognitive behavioral therapy, and that really helps you if you're struggling with an anxiety disorder. And then the other thing that might help you, if you really can control it, or if it's really bad, or if your doctor says that you need medications, we also have drugs for the same. But most importantly, if you're struggling with anxiety, speak out and get help. Speak out and get help. Do not die with it. You're not abnormal. You're not a mad person, but it's something which can happen to anyone. Otherwise, guys, that is all from me. I want to believe that in one way or the other, you have learned something. And remember, this is the place where I come and I empower you. And when I empower you, I also empower myself, and we move forward together as a community. If you haven't subscribed to this channel, please remember to do so. And I really love you guys. But before I finish, I want to leave you with this song. And it says that God is here and we know He will not leave us. Even at this time when all seems blurry and we really can't get clarity, He's still here. So I'll sing this song as I finish. You are here, and you said you'll never leave. We need you, Lord. We need you, Lord. You are here, and you said you'll never leave. We need you, Lord. 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 And guys, as I've been singing, I've just remembered one relaxation technique that I saw. That is, as you focus on your breathing, taking the shallow, long breaths, what you do is that you keep repeating short prayers, positive words about yourself. And I love you guys. Remember again, if you haven't subscribed to this channel, please do so. Bye bye.